give everything that you need to emotionally. And I always felt that after a full day of general practice, I would come home and I could barely speak. I had nothing left to give.
I'm energized when I get back, and I bring that energy to my family so I can be a better husband and I can be a better father.
And that worries me. I didn't want to be someone, if I was, planning to have a child, I wanted to make sure that I could give enough to all areas of my life.
Hello and welcome back to the podcast. Today we have Dr. Harriet Turnbull joining us. Obviously, we've seen her multiple times before. She is now the face of DermaMedical, but I'm going to ask Harriet to give us a little bit of an introduction regardless. So Harriet, thank you again for joining us.
Thank you. Thanks for having me on, Rush.
Of course.
So I'm Harriet. I'm a GP by background, so I was an NHS GP. For many years, I now do full-time aesthetics. I've been a trainer for DermaMedical, I think for about 7 or 8 years now.
Yeah.
And in the last 18 months, I've been doing more behind the scenes stuff, mentorship, developing our courses. So I'm now Chief Medical Officer for the UK and also our global markets. So we're not just a UK-based training academy, as you know, we train all over the world. So the US, Australia, the Middle East, and new venues coming up all the time. So that's how I spend my time now. I started as an aesthetic doctor nearly 10 years ago, working for a corporate clinic on Harley Street, but I now just run my private clinic currently in Belgravia, where I see my patients, and that's me.
Excellent. Well, what a meteoric rise. So did you ever think that when you started off as a I assume maybe junior doctor, getting into aesthetics, that you'd go down this route?
Oh, never. I say I'm a bit of a nerd by nature, loved medical school, just, what's the next exam to get done?
You look forward to exams?
I liked the process of it. I liked knowing what I had to do, getting it done by the deadline, and just progressing through those steps. And then the reality, as I know we've spoken about before, of being a junior doctor was just so different from that I trained with DermaMedical originally because I was just looking for more, looking for something else. I was sick of just living paycheck to paycheck on a junior doctor salary in London. I was sick of the working conditions, from bullying, there was harassment at work. All of these things that just left me really lost becoming a junior doctor, thinking, I hate this is not what I've wanted to do since I was a child. And coming to DermaMedical, I remember that first day, I was just blown away and by the teaching, by the course, and it just opened up a whole new world and has changed the trajectory really of my whole life, not just my professional life, which I know we're going to be talking about a bit today.
I love that about this field, because when I first got started, I didn't think I'd be doing podcasts, I didn't think I'd be traveling the world, teaching other doctors. I just thought, okay, I'm going to have a side business. And my original plan, just become a GP, maybe go into plastic, something like that, but have aesthetics on the side and just see how it goes. And then I've yet to find someone who's done well in aesthetics who wants to go back to their original field, because the flexibility is just unparalleled. You can earn more, it's more enjoyable, the job satisfaction you get. I mean, we can talk all day about why we love aesthetics. What I really want to discuss was your new role as Global CEO. Congratulations, by the way.
Thank you.
So what does that involve?
I think it's just been as we continue to kind of grow and evolve, not just through our face-to-face training, but also through the DermaHub, our online training platform as well. We needed that kind of oversight from a medical perspective to really look at all our different markets. I mean, it's so exciting for us when we see that people are becoming hub members from all over the world, from the US. You see someone buying in Texas, and then Lithuania, and then Scandinavia, and it's just incredible to see the impact we're having, which is ultimately just improving standards in the industry. So my new role is really going to be continue to stay very close to the students and attention there, because that's really who we're here for, isn't it, Rosh? When we're teaching, it's all about giving other medical professionals the same opportunities that we've had, but also just keeping an eye on where we're heading overall in medical aesthetics, especially in the UK, where we've got so many issues with lack of regulation.
I love that DermaMedical is always changing. It's so easy, because we had a blueprint that we used 10 years ago when we first started, and obviously did well because we are the global conglomerate we are today. But we continuously assessed ourselves, and we continuously see what's changing in the market, what's the best products, and the fact that we're continuously evolving means that we're getting better and better education to our patients. That's one thing I really love about DermaMedical, because that is not something you see in a lot of other training schools. No name is mentioned, of course, but it does happen.
Yeah, right? and we don't do it just to tick boxes either. We know that the core of what we do is that we offer an absolutely unrivaled injecting experience. We know our DermaMedical graduates come away just the best, the most competent, the most confident injectors. We really stand out in the field. whether that's if you want to go solo and start your own business or get a clinic job.
So Harriet, obviously you're pregnant. Congratulations,
Thank
by the
you.
way. You look lovely, you're glowing as always. So tell me a little bit about how you've managed to be pregnant, which is a pretty tough thing to go through, and manage your job as a CMO.
Yeah, honestly, I had no idea how tough it was going to be. Last time I was here with you on the podcast, my nausea was absolutely awful. It was all day sickness, not just morning sickness. No, it was really suffering in silence. I'm just so grateful to be working in aesthetics during this chapter. Again, just having the flexibility to work fewer days a week, to be able to work from home sometimes with the admin side of things. It's been so much better than I could have imagined in the NHS. And it's been a really positive thing for me. I think, you know, I was someone who I was never sure if motherhood was definitely going to be part of my life journey. And sort of thinking ahead, part of my concerns was how was I going to manage being a doctor in the NHS and juggling parenthood. I've seen it, I've witnessed it.
So hard.
From, you know, and that's all professionals, from being a pharmacist or a nurse, and trying to do both just seemed an impossible task. And that worries me. I didn't want to be someone, if I was, you know, planning to have a child, I wanted to make sure that I could give enough to all areas of my life. So it's been really, really positive working for Derma Medical with the training, and also my clinic. My patients have been so amazing and so understanding that I'll be taking a break. And it's been really, really good so far. How did you find that sort of transition into parenthood for you?
Well, first of all, I always knew I wanted to be a dad, so that's one of the main reasons I got into aesthetics, because I knew about the flexibility it would afford. But actually seeing that play through has been amazing. So obviously, when George was pregnant around about a year ago, or a year and a half ago, I was there to help her. Like, I only work 2 or 3 days a week, and the rest of the time I enjoy myself, whether that's going to the gym or doing my hobbies. But in this particular time, I was there to support my wife when she was going through the morning sickness. And when she was on her mat leave, I whisked her away to different countries. So that when I was teaching in the US, I took her there with me, and we had a really nice time in New York together. And then when Isla, our lovely daughter, was born, mat leave or pat leave was not an issue for me. I could take off as much time as I wanted. So I took off about 3 to 4 weeks completely, so I could really enjoy that newborn phase. And then after, for another 2-3 weeks, when I thought I should maybe add a little bit of money, all I had to do was just go and see a patient for an hour or two. And because of the profit margins in this field, that was more than enough to keep my business ticking along. And now that my daughter's a year old, my wife's going back to work, I only need to work a few days a week, so I can actually have full days with my daughter and I can watch her grow up. And that's just not something I would have been able to do if I had gone into plastics, orthopedics, or GP. Whatever field I would have done as a doctor, whichever one, I wouldn't have been able to see my kids grow up the way I wanted to. Everyone has different degrees, but for me it wouldn't be enough.
What a change that is from one generation to the next. I think it's so interesting that our kind of generation of fathers, I think it's going to be such a different parenting experience probably from the previous generation who, I don't know what your sort of upbringing things like, but my mum was definitely the primary caregiver when my sister and I were very small, and his job was to earn the money. But I think the balance that you can get now, so you can actually do it as a team, is very exciting. I think for me, I remember when I was a junior doctor, and even when I qualified as a GP, there are a lot of women that go into general practice, and it's always had this reputation of being kind of like family friendly, and I just think that could not be further from the truth based on what I've seen. So a lot of women are kind of drawn into general practice for that reason. And actually, if you think about your average salaried GP, so you're paid on a sessional basis, let's say you're working 4 long days a week is considered full time, you'd probably be paid around £80,000. And that would typically look like a day that would start at probably 7:45 in the morning, and you'd be lucky to finish at 7 p.m. So then what happens is when doctors become parents, especially women, how that would work with nursery, with pickup, unless you have a partner who's incredibly flexible, what I saw happening time and time again was those women were saying, okay, well, I'm going to reduce the number of sessions I do. So they would do just a half day rather than doing those full days. But that would also look like probably starting at about 7:45 a.m. And I'd see them leaving at about 3 p.m, 4 p.m. to go and do nursery pickup. I'm like, how is that not a full day of work? And that doctor would be working 4 days a week like that, which so many companies now offer full-time on 4 days, and they'd be on £40,000 a year. And I just thought, this is ridiculous. And they were still really stressed, trying to condense all of the admin, the other tasks that come into it. And it left them, I've got to say, really often very bitter, very resentful of the situation, feeling like, again, they were working really hard, not bringing in the money that they deserved. And it was just a really rubbish situation. So I personally don't think it's very well set up. And, you know, I think nursing, shift work and stuff can sometimes actually work better for some families and people. But I know the other thing we were talking about before, Rosh, is that there's a lot of job insecurity at the moment in medicine in the UK.
You never thought that would be an issue. As a doctor, I thought I'm always going to have a job. It's not the case anymore.
Yeah. What are your friends kind of reporting?
Well, so there's no locum market at all anymore, and I was okay because I was locuming maybe about 3-4 years ago, and at that point there was enough work. Now, whether you're a GP or whether you're a junior doctor or middlewery doctor, there's just no locum work anymore. But then on top of that, because of the fact that we're hiring doctors from all over the world who are willing to accept lower salaries, and of course they need a job, completely understand, it just means that the salary jobs have reduced as well because they're willing to accept a lower salary. So you're working harder and harder and harder, but you're just getting paid less and less. And the industry has not matched modernization in terms of how much we should be paid compared to other, you know, economically diverse countries. You know, countries like the US or Dubai or Canada, they pay their doctors way more and they have a better quality of life. And if you can't do that, inevitably doctors are going to turn to other things like we did.
Yeah, absolutely. I'm always getting ads coming through on my Instagram for, you know, come and be a GP in Australia and things like that. And it's a really bad state, I think, in the UK. And I understand as well for nurses, like bank opportunities to top up their pay and all of that has really dried up as well. So actually, you know, I'm seeing a lot of people come to training because they want to start that kind of side hustle that we've spoken about. I think that's what most medical professionals go into aesthetics thinking. They want that side hustle, that little something extra to flexibly top up their income. But then they can see the potential of it, of course, and then
side
start
hustle
to
becomes full time.
Absolutely, which we see time and time again. But I think I feel a lot more confident going into kind of parenthood in my job now. And the other side of it, I think, also is to do with your emotional capacity and bandwidth. I'm sure you can probably speak more to that, but being a parent, that's one of the most challenging things is being able to give everything that you need to emotionally. And I always felt that after a full day of general practice, I would come home and I could barely speak. I had nothing left to give. And the thought of coming home, you know, after a day like that to 2 young kids, having a tantrum, trying to get their dinner done, put them in the bath, get them to bed, that just fills me with absolute dread.
Do you know what? This is something that my wife and I reflected on as well relatively recently, because I know for a fact that most couples get into fights when the husband comes home. If we're taking the traditional model, let's say dad's going to work and mom's taking care of the kids at home. Mum has spent the entire day taking care of the kids and she's bloody tired, obviously. But then dad, in a lot of scenarios, has gone away to do a job that he may not necessarily like. And I'd say the majority of people often don't do jobs that they like. And then they come home and he's tired and he wants to relax. But then he's asked to do jobs for the kids. And then there's just this battle between husband and wife because neither of them are necessarily seeing what it's like for the other side. But for me, because when I go to work, I'll maybe work for 3 hours, see some patients I really enjoy seeing, do a treatment that makes me feel happy because my patients feel happy. I'm energized when I get back, and I bring that energy to my family so I can be a better husband and I can be a better father because I want to get home early. That's the other thing. I can get home early. I can get home for 3-4 o'clock and I can put my daughter to bed and spend those really valuable hours with her, which you just can't do when you're doing on-calls. I know you said for some people shift work works better. Sure, it can do, but not for young kids.
No.
You need to be there all the time.
Yeah, you just wouldn't see them, would you? And I think that's so nice hearing you. That's everything I kind of wanted to know and hear, I think, going into this, because I think you're losing your relationship to your career in medicine. I think it's probably not spoken about enough. The impact, the resentment, the unhappy marriages that I think a lot of medics, doctors, nurses do actually have is really common. And I think it's ultimately that situation where both parties feel like they've got the worst deal, basically, So, I hope that that's something that I can hopefully avoid and get a good balance with without having to completely lose all of myself to motherhood as well, and hopefully be able to create at a certain point some balance where I can still have me and enjoy my career, but be the kind of the mother that I hope I will be as well in my personal life. So I have no regrets, certainly in terms of aesthetics, and I would almost argue that it is more secure now than even the NHS, which I never thought would be the situation.
Yeah, and that's the thing. I always thought it was going to be the risk, and actually it's paid off to be the best financial decision I've ever made. Yeah. And as you said, it was only for £3,000 when I first got started.
I mean, that's a really good return on investment. Definitely.
Not bad for a completely new lifestyle.
Yeah.
Right? Harriet, thank you so much for joining me today. It's always so interesting to talk to you about all of these sort of things.
Yeah.
And I really hope that was interesting for you guys as listeners as well. Be sure to send this to someone who's thinking about starting their own family and thinking about aesthetics as a potential side hustle. Guys, thank you so much for joining me today. Harriet, thank you again for joining, and we can't wait to see you on the next episode.